Thank you once again for being here today. We are excited to dive deep into the discussion and look forward to your participation at the end with the forum for open questions. Thank you so much. I'm transitioning now to Eric.
All right, thank you.
Eric.
So I'm going to get started with the current landscape, and there's really a lot of exciting possibilities with artificial intelligence, commonly referred to as AI, and its role with helping in a number of factors. You can imagine all the data that's in healthcare environments, how to sort that out and automate some of those tasks, make job efficiency, uh, you know, keep people safer, create an environment that's more amenable to helping people that are in different circumstances where they might need medicine, or the records might need to be developed in a way that helps medical professionals make sure they provide the best care. But I'm going to get into some of those details first. But from a cybersecurity perspective, one of the things I work with or have to be knowledgeable about are SIM tools, and all that is a security incident and events manager. But one of the things that rely on is ML, or machine learning. And machine learning is a subset of artificial intelligence. And, in that, a SIM tool can take a lot of different, vast amount of information that's much, much larger than what a human can assimilate and process to come up with, a decision based on all of that data. So whereas ML is very focused on just data, artificial intelligence kind of goes a step further, where it can make rule-based decisions. So that's like one of the key factors is, AI can involve that rule-based decision in that process, whereas ML just takes a massive amount of data and learns from that. But we'll get into more of that. Both require lots of information. But as far as the integration go, you can imagine like early detection for diseases, machine learning as part of AI, or AI can identify subtle patterns in EHR, or electronic health records. They can use that data to help people understand if there's early signs of diseases such as sepsis, cancer, chronic conditions, etc. Because it can take all of these different symptoms that people may not readily recognize, and put that data together. So instead of doing a bunch of searches for conditions and trying to make that correlation analysis, it can say, hey, with all of these conditions, this is most likely a possibility. Now, keep in mind that AI is not perfect. So it helps to be knowledgeable in the field that you're using artificial intelligence for. AI helps me in my field and GRC and cybersecurity, but sometimes it makes mistakes. Sometimes it makes bad references. So it really helps to be knowledgeable in the field that you're using it in, because it can take a lot of the grunt work out and the analysis work. And then, if you're a medical professional, you can look at that data and say, that makes sense, or I see where those patterns of why it came up with that decision. And it can expedite that process of trying to diagnose something, or correlate records. Just like a SIM tool will make correlations with machine data, AI can make correlations with records and information from a human human perspective. So it's really a lot of possibilities there. Another one is medical coding. AI can interpret clinical documentation to assist with billing codes, which reduces administrative burdens. So a lot of the medical field is tied up with, doing the grunt work of administrative tasks, and that takes a lot of time and energy. AI can take that data, and it can make the proper correlation and appropriation to those billing codes much faster than a human can, and automate it in a way that medical professionals are doing the job that they're more meant to do, and do more of that customer facing work instead of being tied up in millions and millions of lines of text and data over the course of a year. So imagine the possibilities there. Trend analysis, AI can monitor EHR data across a population to identify emerging health trends and outbreaks. So it can go a step further. Instead of looking at the person and various symptoms there, it can correlate and process a vast amount of data from a region or a state if there's an outbreak, and it could say, hey, these are the regions that we've also seen this occurring, or these type of symptoms occurring above what's normal. And sometimes, the people that make or create these rule-based decisions, they can make that analysis based on unusual activity or establish a baseline, and then AI says, this is unusual. There's an increase in X, Y, or Z. Maybe it's a bacterial infection or a virus spreading, and it can identify it before humans say, oh shoot, now we have 100 people in already having an outbreak, whereas AI can probably pinpoint it a lot faster by taking that input real time and then making a good correlation that people can recognize and address that outbreak prior to it really becoming a bigger problem. Wearable devices and IoT is really interesting as far as the integration goes. Imagine all the things that people wear these days, their watches. Some people have rings that monitor health data, even necklaces I've seen. They can incorporate information from like your pulse rate, the compounds or minerals that are coming out of your sweat, to biorhythms, etc. All that, imagine all that data that's constantly being released and needs to be processed. AI can take a host of that information and come up with diagnoses or possibilities of a diagnosis before it's likely from a human perspective to analyze all that potential data. Because you can imagine with Internet of Things, that's what IoT is it's constantly collecting things. So it's not realistic for a person to constantly be watching data from IoT to make an analysis or correlation of that data. From telemedicine, this is really fascinating. Imagine all the data that you might have from images, like maybe somebody has images, CAT scans, MRIs, PET scans, things like that they might have that another medical professional isn't aware of. They can send that information, hopefully do it in a secure manner, to a medical professional to help them get an understanding of where they're at, what conditions they might have, how they can help them out in that perspective. Symptom checking, of course, it's costly to have medical professionals online constantly answering questions. But one thing organizations can do is they can be aware of, like, what are the common questions, what are the common scenarios that are people seeking to address, and some of those questions that stem from those answers as well, like similar to FAQs. And they can develop chatbots, which are AI. They're designed to interact with people in a more human-like fashion, constantly. So you don't have to have people online having to answer questions real time. A chatbot can at least get things to the next level, or help people real time at inconsistent hours with data based on problems that they're having or things that they're experiencing. Predictive analytics, that machine learning capability I was talking about, that's a subset of AI, can predict potential health events, heart attacks, strokes, by analyzing that real-time data and using proactive interventions through that ability to take a massive quantity of data and also correlating it. That's like another step of it. And then scalable solutions. The cool thing about that is no longer does the healthcare organization have to have their own data center. They can use cloud to help facilitate the functioning and the process of their own AI models if they choose to build those. That's a whole separate conversation, but you can leverage cloud resources to make it easier for yourself to provide more services and expand those, even making it easier for underserved regions or regions where it's not economically viable to build a hospital or have a clinic. So there's some good possibilities there. As far as the challenges, especially with data silos and interoperability, things like HIPAA and GDPR can limit that exchange of information. Of course, GDPR is more concerned about where the citizen resides and where the data resides. But if you think about it, large language models require data. You can't make decisions and use those rule-based decision-making abilities unless there's a lot of data. OpenAI has invested, billions of dollars in building models. So, and you can imagine all the data that requires. But that can be further restricted, especially in the healthcare environment, because you have HIPAA and possibly GDPR concerns. When you think about where clients could be living at the time, and they rely on a healthcare organization to handle their needs. There's diverse electronic health record systems that may be disparate. Different departments or facilities may use different electronic healthcare records that are not compatible. So that's a possibility too. Not having a uniform language or language set that's readily assimilated by that large language model could be a potential problem. Organizational barriers, competition, proprietary interest. Of course, there's a lot of IP within the healthcare environment, especially in the pharmaceutical industry. There's a lot of things where, they may not want to share that data. They don't want to risk, so there might be an inherent risk where it's like, hey, we're just not going to take the chance of releasing any kind of IP. So you might run into those problems, especially in the healthcare environment. As far as like ethical concerns and compliance, informed consent is a big part of that, especially in healthcare. Patients may not fully understand how their data will be used, how it's stored or shared when consenting to AI applications. The government is very, from my experience, I've worked with a lot of government clients. They're very, very apprehensive to fully adopt AI right now because there's a lot of privacy concern, and if that data gets in there, they might have CUI or controlled unclassified information or even more sensitive information put into AI because people will use that data to come up with an answer to solve a problem. So there's that potential of a or privacy concern or just sensitive data in general. Data anonymization challenges. There's fully anonymizing data while retaining its utility for AI is technically challenging. There is the possibility, like I said, AI does have it is possible that AI makes mistakes. I've seen it firsthand. But like I said, in my field, I know enough about what I do where I can say, okay, a lot of that makes sense. That's useful, but I know this isn't correct, so I'm not going to use that data, or I'm going to look into that more because that doesn't make sense to what I do in my job. So, hopefully, there's a healthcare person that's on hand that can look at it because there could be a misdiagnosis, from AI. It's really good at taking a lot of data and making possibilities. Like, for instance, you may take a number of symptoms, and it might be possible that there could be 3 or 4 different kinds of diseases possibly. So if it chooses one, that doesn't necessarily mean that's what that patient has. It just means it's a possibility. But if a physician saw that, they could say, hey, let me look into that. Nope, that's not it. But these are other possible diagnoses that I can look into and kind of move that process along for a healthcare physician. Then there's the approval process. Regulatory bodies may lack the expertise or frameworks to evaluate AI systems. AI has been around for a while, but the adoption of it, the advancement of it, especially from a generative AI perspective, is relatively new. So a lot of organizations, they don't really have a lot of familiarity or expertise with it, especially from a privacy perspective and how to prevent those things. And there's different processes they can leverage to ensure more privacy, but AI is not perfect yet, and it's going to take some time to develop, but it's still very useful, especially in the medical field. But those are some of the concerns that we should be aware of